My name is Julie Retson. I'm a family physician, a medical director at Kenora Chiefs Advisory, and I do a lot of work with our All Nations Health Partners Ontario Health team as well. In addition to my professional role, I am also a patient. So I've had a diagnosis of stage 4 colorectal cancer with spread to my liver. I did not have any positive experiences using the travel grant. It was extremely onerous and difficult during a very hard time in my life. Up north here, we have the requirement to travel to Thunder Bay, which is our closest regional cancer center, so over 500 kilometers away. This happened in the winter, so I was having to travel on icy, treacherous winter roads. Initially, what sometimes is required, I think I had 4 MRIs within 2 months. Oftentimes, even Thunder Bay doesn't have the specialized services that are required. So I also had to travel down to Toronto and had 4 surgeries within a year. So to get there, it's a 3-hour drive to Winnipeg, 2.5-hour flight to Toronto, then a half-hour taxi ride to the hotel accommodations, which costs about $80 in and of itself. And then hotels cost upwards of $250, $300, $400 a night. Oftentimes, it's not a quick visit. The costs were astronomical. When we went to apply for travel grant, I was very sick, and to fill out the travel grant application, it felt impossible. So the first one that I sent in immediately got rejected, and you need to send it in by mail. It was very difficult, and actually I ended up giving up.
We've just had an experience with my husband. He was diagnosed with an oral cancer in July. He was slated for 6 weeks of radiation treatment, which ran Monday to Friday. At the beginning of the journey, before surgery, Joe had to go and he had to have this appliance made for his mouth because they were removing part of his palate. We sent that claim in and it got denied. So I had to go back to Dr. Paddock. This is a cancer specialist surgeon, and ask him to do another letter.
I usually get denied and just give up. The last time my daughter had a tonsillectomy, the surgeon wanted her to stay in Winnipeg for 2 weeks. And so I had a letter from the surgeon. I got an Airbnb, which was reasonable. I submitted all the appropriate paperwork, and all I got was mileage. And I tried calling about it and just kind of gave up.
I absolutely have had negative experiences with the travel grant program. 7 and 8 years ago, I was going through cancer care. Most of the travel grants were paid without incident. However, after breast cancer surgery, I had to return to Winnipeg because of some complications. The doctor advised me to come back the next day as well. That travel grant was refused because you're not allowed to have 2 appointments back to back. We had to fight for that one. And the last thing that you want to do when you're fighting for your health or potentially your life is to be fighting bureaucracy.
So then we went back and forth with radiation for 6 weeks. We got the mileage, but they denied the rent receipt because it wasn't an official receipt. And I said, well, what am I supposed to do? This is the receipt that the landlord gave me. And then I broke down and I was mad. I said, look, my husband is sick. We're trying to just keep him alive, and I'm in tears. I could do that, and even though it was really frustrating for me, my husband couldn't have done that. He's not capable of doing that. He's too sick to do that. It's not fair. It's just not fair.
And I know the government has a duty to spend responsibly, but also has a duty to the patients that are going through a low time in their lives.
I think if there was a medical transportation option, I think that would provide greater and more equitable access to health care.
Everything is digital nowadays, and here we are still with this paper form and the mail. And I think there could probably be some digital boxes that could be clicked.
Why don't they pick up the phone instead of writing the letter? Well, tell me what takes more time, typing out a whole letter or picking up the phone and saying, hey, can we figure out what this is all about?
If you run into problems, someone who's on the other end of a phone who can sit and fill it out with you. Because again, when people are sick, sometimes they just don't have the mental capacity and focus to be able to fill out the forms. So that type of support, I think, would be really valuable.
The services and the medical personnel we have here are great. They're very patient when it comes to the travel grants. They have better things to do than filling out these forms and filling them out every day. Like in the case of radiation, that's 5 forms a week. Their time would be better spent with patients rather than paperwork.
I think it's moving in the right direction. I don't think it's even close to adequate. It doesn't address some of the barriers about people that have no finances, have no credit cards, have no savings, have no people, especially when you're looking at something like oncology, not going to a tertiary center to get the treatment you need is death.
We deserve equitable health care. Just because we live in the north, we should not be penalized.
You certainly learn the inequities, the health inequities, when you become a patient up here. I think if people could just go to Winnipeg and not be rejected because they're from Ontario, one, it would save a lot of travel grant funding, but two, it would allow a lot of people not to fall through cracks and get the treatment that they deserve.